stop talking, please? Take out your... Sylvia, not only are we going through this, but it's being recorded. So stop talking, please. Take out that sheet I gave you, and we are going to go through the controls. I don't expect you to know everything, but we are going to go through the video. This is the worksheet that I gave you when you first came back. This is the video that you watched. It is on Classroom. Move on a second. All right, shh. Let's talk about normal ventilation and what controls normal ventilation. The region of the brain that we're going to center on is your inspiratory area and your expiratory area, because those are the ones that are going to be controlled most of your normal breathing. So if you look at the inspiratory and the expiratory area, they are in the part of the brain they call the medulla, or what we call the medulla oblongata. Normal breathing only involves your inspiratory area. So normal breathing, my inspiratory area sends messages to my muscles. What are the two muscles that are contracting during normal ventilation? I shouldn't see phones out. I shouldn't see you other places. Pull out that worksheet, because this is exactly what the quiz is on Friday. My external intercostals and my diaphragm. So a message gets sent to both of them. They will actually begin to contract, and we'll let this play without, let me make sure my volume's off here. You guys went through this, but it sends the message to that. It sends it for about 2 seconds. In that 2 seconds, my external intercostals will actually raise up and contract. My diaphragm pulls down, and then the signal stops for 3 seconds. Why does it stop for 3 seconds? Because what happens after I inhale? I exhale. So once that part of the brain stops sending a signal for it to contract, it automatically relaxes. Once it relaxes, it doesn't take any energy or any signal. Your chest cavity goes down, your diaphragm goes up, you exhale. The signal goes again. That's how it's controlled. Unless, of course, you need a heavier amount of respiration. So that's what happens with just tidal. My medulla oblongata, the inspiratory, sends the message. It goes and it causes the lungs to, the diaphragm and the external intercostals to actually contract. That will cause the respiration. So if you're talking about exercising, what happens above and beyond? What happens if I start exercising? What has to increase? What if I want to go from tidal volume to using my respiratory reserve? What has to be stimulated more? My diaphragm and my external intercostals. That's when we actually get into the pons and some of the other areas, because when you are just using normal quiet ventilation, you're not using the expiratory part of that medulla. You're only using the inspiratory. Okay, and this is what we call a spirogram, and you saw that I think in some of the presentations. When it's going up, the person is inhaling. When it's going down, the person is exhaling. It measures your normal amount for your breaths. So that is going to be seen as a normal breathing pattern. And that's what we call the tidal volume. Your normal tidal volume is how much you inhale and exhale. The inspiratory area stimulates the external intercostals and the diaphragm to get that amount of breathing. When I start exercising heavier, which is called forced ventilation, not only do I need to stimulate the normal muscles, but I also stimulate the sternoid muscles up here to help lift the rib cage even more. The other thing is I also then need to use the expiratory area. So if you're doing forced ventilation, you're using additional muscles up in the chest to pull your chest up. When you're exhaling, you're actually going to start using your abdominal muscles to force it down. So during forced respiration, you've got signals being sent both from your inspiratory area and your expiratory area, because not only do I need forced ventilation, but I need forced exhalation too. So that gets us way above tidal volume. It also gets us to exhale more than we normally would. Some other controls. The two areas in the ponds you do not need to know, but they are areas that will help to regulate with the medulla what your breathing rate is. There was a question on the hypothalamus. The hypothalamus also plays a role in ventilation. What is your hypothalamus influence? Emotion, pain. It's up on the screen right now. Pain, temperature changes, emotions. So those things also affect your breathing rate. So the hypothalamus can kick in over the medulla and say, okay, she's crying right now. They need to actually have more inhaling and exhaling. The ultimate override is your cortex. So, for example, I'm singing in a concert or I'm playing my musical instrument and I need to regulate my diaphragm, so I'm exhaling. I'm lecturing and I need to get more than one sentence out at a time. Your cortex can override. The cortex of the brain will use the diaphragm and the external intercostals to help make it so that your flow of air is even. So, the regulatory as far as the brain, medulla oblongata, inspiratory area stimulates external intercostals and diaphragm, causing you to inhale. It stops the signal and it does not require a signal to exhale. During forced ventilation, not only are stimulations sent to inhale, but then the expiratory center also sends signals to exhale. To inhale harder, you use your mastoids. To exhale more, you use your abdominal muscles. Your hypothalamus can affect it with emotions. Your cortex overrides it when you need to regulate. So most of the time, breathing is not voluntary, but a lot of times you can control it when you're laughing, when you're talking, when you're singing. So all of those controls are used by the cortex. So those are all the brain areas that influence this. We also have blood chemistry. When you inhale, you have oxygen attaching to hemoglobin. So your body looks at PO2. In other words, what's the pressure of oxygen, partial pressure of oxygen in your blood? You also look at carbon dioxide levels. Are they going up or are they going down? So you have chemical receptors in your nervous system that monitor specifically hydrogen and CO2. Reason for that is hydrogen levels will change my blood pH. And remember, blood pH can only be between 7.35 and 7.45. So changes in my respiratory rate can affect my blood pH. So they're going to monitor all of those to monitor your respiratory rate. So if you look at this, hyperventilation. So if I am having too high levels of CO2 and H, my oxygen levels drops. What happens is it stimulates the area of the medulla in your brain. Basically, it causes you to increase your breathing rate. So if your carbon dioxide levels go up, your hydrogen level goes up in the blood, it stimulates the medulla to start getting that inspiratory area to start you breathing more rapidly. When you are hyperventilating, you are breathing more deeply and intensely. Once I start breathing faster, what does that do to my CO2 rate? My CO2 rate is going to, couple things. It's eventually going to, but I'm removing the CO2. So that goes down. I'm increasing oxygen and it brings it back to normal. So, good example, a little kid who's spoiled. I'm going to hold my breath until I turn blue. Okay, so they start not breathing. Carbon dioxide and hydrogen levels go up. They pass out. No, you cannot kill yourself that way because that inspiratory, as soon as you stop losing conscious control, will kick it in and start you breathing again. They will breathe heavier, hyperventilation, because they don't have enough oxygen and they have too high levels of CO2 until the oxygen levels go up and the CO2 levels go down. Then they go back to normal respiratory rates. Hypoventilation. Hypoventilation is when I'm not breathing deep enough. That's when CO2 and H levels decrease. oxygen levels begin to rise. What do they usually make you do when you have this happening? If I have hypoventilation, then basically, if I am breathing too shallow and I am not getting enough CO2 buildup, then it will actually slow down your breathing rate. And what can you do to do that normally? If I start having CO2 levels decrease and oxygen levels increase because I'm hyperventilating, how can I stop that? Yes, why do I breathe into a bag? Breathing into a bag means I'm inhaling more what? Carbon dioxide. So if my carbon dioxide levels begin to rise, my respiratory rate will slow down, which also then decreases the amount of oxygen and allows CO2 to accumulate. So if I have too high of levels of CO2, I will begin to breathe more rapidly to get oxygen levels up and CO2 levels down. If I have too low of a level of CO2 and too high of a level of oxygen, I will begin to actually slow down my breathing. I will try to breathe more deeply. It will try to get you to bring in more oxygen and release more carbon dioxide. So part of what you're looking at is pH. If you slow down your breathing rate, you decrease your pH. If you increase your breathing rate, you increase pH. So it's also monitoring the chemicals in the body. So for this quiz you're having Friday, you need to know the centers of the brain that regulate it. You need to know what happens when you have normal ventilation versus forced ventilation. You need to know what chemical compounds in the blood are being monitored and what happens during hyperventilation and hypoventilation. How does pH change? How does CO2 and oxygen change? Questions on that? How pH levels change, how oxygen levels change, and how carbon dioxide levels change. Questions on that? That should have answered most of the questions that were on that worksheet. So if you would go ahead and hand those